Thank you for coming. Even though we're only going to be together for about 30 minutes, I promise to make this time well invested. I see we have holistic practitioners of all kinds with us tonight: nutritionists, herbalists, aromatherapists, flower essence practitioners. One thing I have learned over my years in the holistic wellness industry is that excellent healers keep learning. They know they don't know it all. So congratulations for being in that small minority who continue to learn, who strive to be your best, and who strive to give the best to your clients. I'm excited to have you with me tonight. Even with all your learning and all your best intentions, you are likely faced with some challenges. Sadly, you are probably even creating some of the challenges on your own in your practice. Let's take a peek at what the most common challenges are. Lengthy intake forms. You know, your clients hate them. And after you've scanned the form once, do you really take the time to read it through again after that? Likely not. Lengthy forms are pretty much a complete waste of time for you and your client. The second challenge is not knowing exactly where to start in your recommendations. You have problems maybe setting priorities for your client's treatment. If you don't know where to start making your recommendations, it's probably because you have a lot of recommendations you could make, and they're all good, right? So you need some help learning how to set priorities and therapeutic sequences for each client. Doing research, program development, and things like that outside of client time, but you're not getting paid for it. Now that's a problem, isn't it? Because if you're not getting paid for it, let's say you charge $60 an hour, you spend an hour with your client, and you spend another 2 hours doing homework for them outside of their appointment time. So you've spent 3 hours and you're only making $60 for all of that time. So that's a little bit of a problem as well. And sometimes in the process of doing all of that research, it means that you actually come back to your next client session with so much information that you overwhelm your clients, and they don't come back because they feel like they could never do everything you've outlined, or they think they've got everything they need now, so why should they bother coming back? So how do I know that these are problems? I know that because I've been there myself, and I've interviewed a lot of holistic practitioners, especially nutritionists and herbalists. So who am I and what qualifies me to share this amazing information with you? Well, my name is Judith Cobb, and I've been a holistic health coach since 1981. I'm a master herbalist, a holistic nutritionist, and nutritional consultant practitioner. I'm a certified iridologist and a certified comprehensive iridology instructor. I'm a teacher of wellness professionals and have been since 1985, a wife of one, a mom of 7, and a grandma of 7. I've made every mistake a person can make in a holistic wellness practice, and I've done it while having and raising our 7 children. I've invested so much time and money, a lot of it in making mistakes, in learning how not to build a business, and less of it wisely by investing in classes and workshops with mentors who could lead me through the landmines of building a holistic wellness business. My goal is to save you time, money, frustration, and the discouragement of making the same mistakes I've made. So I want to introduce you to a new way of doing things, a way that will eliminate all of the challenges we mentioned earlier. Does that just sound too good to be true? Here's how it works, because you really can eliminate all of those challenges. What I will teach you will show you how to gather a base of information from your client. Let that base of information teach you what to ask next. Let those answers teach you what recommendations to start with. Let all of this teach you how to proceed for the next several sessions, so you set up a priority sequence for your clients' sessions. and it will help you to build rapport more quickly and deeply without using a lengthy intake form. So how do you normally start a consultation? You normally gather the person's name, gender, age, height, weight, and birth date. You ask them what problems they want your help with. And you ask them what medical diagnoses they've received and what prescriptions they're currently using, right? Then what? With the system that I'm going to share with you, you will need about $25 worth of equipment that you can buy at Target or Walmart or a stamp collecting shop. Seriously, the only high-tech thing you're going to need to know is how to change the battery in your flashlight. All you really need to do the work I'm going to share with you is a magnifying glass and a pen light. Now you can have a fancy magnifier like this that has a fancy light built in. You can have a simpler one like this that you can pick up at a stamp collecting shop, or you can just get yourself a magnifying glass and a pen light. Yes, there are fancy, high-tech, expensive cameras that will do the job I'm going to teach you about, and yes, I've got one, and yes, I use it with all of my clients, but it's not where I started, and it's actually not where I start in each client session. I start each client session with the questions we just asked, name, age, height, weight, all that kind of stuff, and then I pull out my little magnifier. Then when I've gathered my base of information, then I use my camera, and I'll show you what you can do with this amazing and portable equipment. You can look into someone's eyes and read them like a book. Well, almost. Here's just one of the beautiful things about iridology. It's not a diagnostic tool. It's an assessment tool. When you do iridology correctly, you will never get into trouble with diagnosing or naming a disease, or prescribing, which would be naming a cure. But you will have so many critical insights into how a person is put together and where their genetic strengths and weaknesses are, that you will be able to lead people to better health. The irides, that's spelled I-R-I-D-E-S, which is the correct plural of the word iris when we're talking about eyes, are genetic indicators. Now, we know that we can change our genes if we work at it long enough and hard enough and with the right focus. And so what that tells us is that our eyes are fairly stable from the time we're about 6 years old because they are a reflection of our genetic structure. So you see, the irises give us gifts of information, but they don't give us disease names. The information they give leads us to the next question and the next question and the next question, and of course each question gives us a valuable answer. So I use iridology to understand the genetic strengths and weaknesses of the person and to create a long-term approach in what I recommend for food, herbs, and supplements. I use the whites of the eye, or the scleras, to tell me what is going on now and where the hot spots are that we need to address. Blue eyes like this, also known as lymphatic eyes, are some of the easiest to read. The fiber and other markings are often very clear and easy to see. Using modern technology, we can often see even more detail, and that technology is as simple as a magnifying glass and a pen light. So let's start out with a case study here on a set of lymphatic eyes then. Just like you, when I start a consultation, I make a note of the person's gender. This was a female. Her age, she's 27. Her weight, 220 pounds. Her height, 5 feet 8 inches. I get her birth date, but I didn't put that here because that could be an identifier for her. And then I ask her the other crucial questions. What are your concerns, and have you had any diagnoses? So her main concern when she came in was that she'd had one miscarriage a few years previously, but she'd had no successful pregnancies. She has a history of frequent urinary tract infections, of yeast infections. She craves sweets and eats fruit to satisfy her sweet cravings. Now, those of you who are nutritionists are already starting to put two and two together here, I'm sure of it, and you already have some ideas of things that you want to do with her to work on some of those symptoms. The question that I wanted to ask her, and that I did ask her, was putting together the fact that she weighs 220 and she's 5'8", so she's a little on the heavy side, and that she has pregnancy, fertility issues, and sweet cravings. That all suggests to me, with sweet cravings with yeast infections, it all suggests to me that she might be type 2 diabetic or have polycystic ovarian syndrome. Now, I can't make that diagnosis, but I certainly did suggest to her that she should talk to her medical doctor, get some blood tests done, get her blood sugars tested, and be checked out for PCOS. So once I've gathered that basic information, I'm going to pick up my pen line and I'm going to look in her eyes. I'm going to always start with her left eye. And I'm, of course, asking permission to do that. I'm going to take a look, see what jumps out at me first. Then I'm going to look at the right eye, see if the same kinds of things jump out at me. And I'm going to make notes about those things, and I'm going to ask her questions. So the first thing that jumps out to me is that the very center of her irises are very, very dark. Right? The area that bumps up against the pupil is really dark. So that's number one. Number two, I notice all of these blood vessels that are very, very active and that are showing me all kinds of interesting things. Now you can see she's wearing contact lenses. So this blue haze here is just her contact lens. The third thing that I notice that jumps out at me is the amount of clouding. Now clouding is happening in a couple of areas here. We've got clouding around the periphery, but we've also got some clouding coming off of this line. So this stuff in here and up here. So see how fast that was? And there's so much more we could even talk about here. We just don't have time to do it all now. So I already know about her more things than a 5-page questionnaire could ever tell me, because I know what each of those indicators means. So now by asking the right kinds of questions, I can get even more information, and I can get the exact information I need to structure the next 4 to 6 appointments for this client. This allows me to give her the right amount of homework in each appointment so she can successfully accomplish it and will want to come back to learn more and to make more progress. So then we are going to start analyzing some of these things. Now, we didn't talk about her being lymphatic. Blue eyes are always the lymphatic genotype. That's the easiest thing you can actually see from 3 feet away, right, is what color are her eyes. We know that people with blue eyes, this lymphatic genotype, almost always will have a weakness with sinuses, mucus, skin. So I'm going to ask her, any sinus issues, any mucus congestion, any skin issues? And if she says yes to any of those, I am going to then make a note that I want to, at some point in our series of appointments, educate her about getting rid of dairy and why she should. Have her educate her about how most grains are not helpful for her, and educate her as to why citrus is probably not helpful for her either. And then that dark pupillary zone, so that zone that is hugging the pupil in both eyes. That's all about digestion right there. So I'm going to ask her about her digestion. Does she burp? Does she pass gas? Does she have a heavy feeling in her stomach after eating? Are there foods that just don't work well for her? And she's probably going to say yes, that there are certain foods that she avoids because they don't feel good. Some of the suggestions that I'm going to put on my list to talk to her about are cutting out things that are not good for her stomach lining, like black tea, green tea, white tea. I'm going to possibly suggest to her that she incorporates some herbs into her foods, so things like ginger, dill, and sage. And I might suggest some other supplements as well, but I'm also going to suggest food combining or food sequencing to make this whole process easier on her stomach. And then with my little handheld magnifying glass, I'm going to be able to see that there are some very tiny, dark little dots just inside this ring. These are called crypts. And when I see those, I know I need to ask her about her bowels and about any history of bowel issues like polyps or diverticuli. And as she tells me a bit about her bowel habits and things like that, then I will know if I need to teach her about the importance of having a bowel movement for every meal. And do I need to also teach her about yellow and orange vegetables, about doing daily abdominal massages, things like that to help her bowels function better and to help prevent these little dark spots from becoming really nasty things as she continues to go through life. In this iris, I mentioned in that first assessment piece about clouding, and so in here what we see is that there is clouding over here and over here, and there is clouding over here. This all suggests to us that that her lymphatic system needs some flushing, and so we're going to get her to do that with daily physical activity. We're going to ask her first, are you physically active? Because remember, if she is physically active, then these are just a warning of what could go wrong. But if she's not physically active, we're going to coach her as to even getting out for a good 20 to 30-minute walk every day. Now this ring that comes around here is what we call the collarette. And in a lot of places it gets a little bit thicker, and in some places it gets really thin and almost disappears. So just outside the collarette up here, and especially in this eye, we can see orange stuff bleeding off. Here it's just a little bit white cloudy. This is sitting in the pituitary zone. And so we need to ask her about her hormone balance, because you know already that pituitary controls thyroid and ovaries. You also know that the entire endocrine system is totally reliant on minerals. So we want to ensure that she's got a superior mineral intake. And we're going to spend some time giving her ideas on how to prepare her vegetables to protect the minerals in them. Then, because her main concern was that she was subfertile, and we've already touched on some of the hormonal stuff that could be going on, just some of it because there's a lot more. Then we want to look at the uterus and see how is that looking. So the uterus shows up at about 7 o'clock in the left eye and at about 5 o'clock in the right eye. And in both of those areas we see a lot of clouding. So we know that the uterus might have some little quirks and issues going on as well. Do you see how quickly that assessment was? And that wasn't even everything that we can see. That was just some really key points. So when you understand the iris, and further when you understand the sclera, do you see how you can actually integrate your nutrition knowledge? Because you understand how food behaves in the body. When you understand where the body's having problems, you can then make your food recommendations, right? If you have a herbal background, same thing. You understand how the herbs work in the body. When you understand what the different indicators are in the irises or in the irides, you can then pair that indicator with the herbal support it needs and work to build a constitutional program that way. You probably understand from all of your training things about lifestyle, things about sleep, exercise, stress management. You might even have some emotional tools in your toolbox. So you can then begin to integrate some of your lifestyle knowledge as well. And you can then, going down the list of what order things popped out as you were looking at them, you can then prioritize which pieces of education and homework to share with your clients and the sequencing for them. So I will almost always start with the digestive tract, with the gut. If that is something that pops out anywhere in the top 3, that's usually where I'll start, because it does no good to give them better foods and supplements if they can't digest it and assimilate it. Do you see how easy that was really and how quickly it went? So with all of that information, You will be able to eliminate lengthy intake forms. You can use your conversation over an iridology assessment as the intake form and be asking relevant questions, not a lot of out there nonsense general kinds of questions. You can target it, and you will know exactly which problems to address first and what recommendations to make. So this allows you to prioritize your program sequence and of what you should do with them now, next month, the month after that, and the month after that. And I really encourage, as you're looking at eyes, to write down what you see and what order you want to deal with it in. This really reduces the amount of research and program development design time you're doing outside of your client appointments. It means that you can, because you can quickly and easily assess your client on the spot, and because you already have nutrition and or herbal training, you'll be able to outline 2 or 3 actionable pieces of homework for your client right while you are in the consultation. And you'll also be able to outline for yourself recommendations for the next 4 to 6 sessions. I really don't recommend giving more than 2 or 3 solid recommendations per appointment. It is just too overwhelming for your client, and we're trying to avoid that, remember? And of course, doing this will keep you from overwhelming your clients with too much information. They will leave with confidence knowing that they can do what you've taught them and they can be successful. I used to give so many recommendations that I actually heard from people years later saying, I didn't come back because I couldn't do all of it. I couldn't be as perfect as you wanted me to be. And I felt so bad about that, that it really taught me the lesson to less is more, give less, because they can do it better, and the more success they have, the better it looks on you as well. And you want them to become long-term repeat clients, right? So now I want you to be on the lookout because, of course, we have another one of these little webinars coming up on August 23rd. So please go to iridology.education and register for that. And that will also on that website, if you would go to the little opt-in, there will be a nasty little, those pop-ups that we all hate. It'll pop up. Go ahead and register on that. Receive the free download gift that I want to give you. And that means that you'll be on my email list to hear about more of these as they come up. Now, don't leave just yet. Don't leave just yet, because there is more exciting news. And some of you have been asking for this because you've been with me for a lot of these. Here it is. The start date has been set for Confident Healer Integrated Constitutional Iridology for Nutritionists and Herbalists. That start date is Thursday, September 15th. Now, this is going to be an amazing class that is going to teach you everything you need to know here. And I'm serious, it's going to teach you an awful lot. It's going to teach you beginning to advanced iridology. It's also going to teach you sclerology, and it's going to teach you both of these things at a level that will prepare you to take the International Iridology Practitioner Association certification exam if you so choose. That's an additional fee. It's a separate event, but you will have the training you need because all you need is to know the eyes and the sclera. You don't actually need the herbs and the nutrition to do the exam. I will also, however, teach you basic nutrition and basic herbology as they relate to iridology. Right? And so I'm not going to be teaching, this is not a herbology class, it's not a nutrition workshop, but I will teach you nutrition and herbology as they relate to iridology. So mark September 15th as the start date on your calendar, and be sure to be with us on August the 23rd, because on August the 23rd, during our 30-minute workshop, I will be opening the shopping cart, as it's called, for a very, very short time. It will open on the 23rd, and it will stay open for a short time. And in that 30 minutes, however, for those of you who are live with me on that 30-minute workshop, there will be a very, very special early bird discount for you. People who register after the 30-minute workshop is over or do it simply through the website will not get the discount that I'm going to be offering to you. And there will also be a 3-pay option. Now this class is actually, as I'm getting all the pieces in place, it's looking like it's going to be about 20 classes. So somewhere in the neighborhood of 30 to 40 hours of educational time. And each class will be presented live and will be recorded. Each recording will be cut into smaller segments, and all of the segments will be posted along with the handouts to a member-only site for you to access for a full year from our start date. So if you have to miss a class, don't worry. It's going to be on a website that you will have access to. And if you don't have a 2-hour block to sit down and watch the whole thing, it will be divided into topic chunks so you can actually sit down and just watch a topic at a time and really get a grasp on that. And if it's a long topic, it'll be divided into 2 or 3 sections so that you can get a grasp on it and be really comfortable with that. Now, your tuition for this class includes a student membership to the IIPA, just in case you want to be involved further with IIPA. So be sure to register for the next 30-minute workshop at iridology.education, and it's happening August 23rd at 6 p.m. Just before we go, though, I'm really interested in getting some feedback from you. What kind of free online download relating to iridology would you, oh, typo in there, would you want to receive in exchange for providing your email address? So what I'm asking here is, when you go to iridology.education and that pop-up window pops up and you put your name and your email address in there, you are getting, as it stands right now, you're getting, I believe it's a copy of an iridology chart that I love, the one that we actually use in class, and another chart that connects foods to physical symptoms. Okay, so I'm wondering, what kind of information would you love to see in that kind of a free download where you'd go, of course I'll give you my name and my email address in exchange for that information that you want to give me, right? So I'd love it if you would just shoot me a quick little email or, you know, something like that. Contact me through Facebook, through my Cobblestone Health site on Facebook, or my iridology.education site on Facebook, and let me know what you would love to see as a free download. Some ideas, again, are the food and iridology cheat sheets, a herbal remedies and iridology cheat sheet, maybe the first few chapters of an iridology textbook that I've written. Maybe it would be a series of 3 or 4 videos that teach you some other basic iridology background stuff that would be foundational to what we'll be adding on to in the class. So I'd love to hear back from you, and I hope you have a wonderful evening. Thank you so much. Good night.